about your mission to Zimbabwe with the Operation of Hope team. I've seen incredible photos at some of your events that you hosted showcasing the work that you do. Could you describe what it's like being out there?
Yeah, so I've been on probably 7 or 8 missions now with Operation of Hope. It's an organization run by Jennifer Trudenbach, the organizer in California, and
Mhm.
they've been doing missions to Zimbabwe for 20 years now, and certainly more than 20 missions because often they go twice a year.
Mhm.
It's a very well run organization. Uh, Basically, Jennifer will set up clinic days for patients to arrive using social media to let people know about our arrival.
Mhm.
When we arrive, there's a giant clinic day with people from all over the country. Uh,
Mhm.
Many people arrive. It takes them days to get there, walking and by bus. Many of these people are obviously the poorest people you can imagine. They
Mhm.
don't have access to healthcare
Yeah.
in any kind of easy or meaningful way. And so we spend our first day running through the clinic. Sometimes there can be more than 100 patients to evaluate. And that's a very difficult day because we have to triage the patients we can help. Obviously, we can't
Mhm.
help everybody. We don't have the resources or the time to do everything that needs to be done. But we try to triage patients to give surgeries to the patients for whom we can. The easiest way to describe it is the biggest bang for your buck. So we
Mhm.
want to help the youngest and give them the most functional results with the minimal amount of risk. We don't have access to blood products. We don't have
Mhm.
access to ICUs. So we have to do things that are going to be successful and work predictably. And then we just operate. We operate every day. While I'm in the clinic, the anesthetists and nurses are setting up the operating rooms. We
Mhm.
turn sometimes what is a just a room, and when I've been with
Mhm.
other organizations like Smile Train, we'll turn a classroom into an operating room. We bring all our stuff with us, our equipment, lights, anesthesia equipment, uh,
Mhm.
and then convert these spaces into operating rooms. We then work as many hours as we can in a day. Usually it's 6 a.m. to 6 p.m. And
Wow.
we'll try and do 4 or 5 surgeries in a day. And obviously, there's a huge amount involved in getting those surgeries done, having the patients checked preoperatively, making
Mhm.
sure the surgery is safe, and then recovering them safely, sending them
Mhm.
home with instructions and rehabilitation so that they can fully recover.